Pills and pumps not working? The science behind how men regain sexual health after 60. Let's begin with why this happens. Many men in their 50s, 60s, and 70s start noticing something they rarely talk about. The body doesn't respond the way it used to. The desire is still there, the feelings are still there, but erections become slower, softer, or almost disappear. And that leaves many men unsure of what's happening inside their body and unsure whether anything can actually improve. In this video, we're going to look at what research from Harvard, Mayo Clinic, Cleveland Clinic, and other trusted medical sources say about how the male body changes after 60. And if you stay until the end, you'll hear about a solution with a satisfaction rate as high as 95%, often used when most other methods have failed. But before we talk about the options, we need to understand the most important part: what's changing inside the body and why. And now, let's take a closer look at what really happens inside a man's body. It's easy to blame everything on age, but major medical sources show a more detailed picture. No part of the body weakens simply because another birthday passed. Most of the time, it's a combination of slow, predictable biological changes that build up over time. When you understand those changes, the situation becomes less frightening and more manageable. One of the most common changes described in scientific literature is the gradual weakening of blood vessels. Erections depend entirely on blood flow. Inside those vessels is a thin lining called the endothelium. When you're younger, it produces nitric oxide, the signal that tells blood vessels to relax and send blood into the penis quickly and strongly. Harvard reports that as men age, nitric oxide decreases, and the ability to open those vessels becomes slower and weaker. That alone makes erections harder to achieve. At the same time, the vessels themselves begin to narrow or stiffen due to cholesterol, high blood sugar, high blood pressure, or smoking. The arteries that supply the penis are some of the smallest in the body, so even mild narrowing can have a major impact. That's why many cardiology groups call erectile dysfunction an early warning sign. The smallest arteries show problems first, but blood flow is only part of the story. Mayo Clinic explains that the erectile tissue itself changes. In ideal conditions, this tissue works like a soft, elastic sponge. It fills with blood, expands, and holds firmness. But if the tissue doesn't get enough oxygen, especially when nighttime erections become weaker with age, some of those elastic fibers can slowly be replaced by stiffer scar-like tissue. When that happens, the penis can't expand or stay firm as well as before. And in some men, the overall length gradually decreases. This has been documented in multiple studies. The nervous system also plays a key role. The signal for an erection must travel quickly from the brain down through the pelvis. Long-term diabetes can damage those nerves. Prostate surgery can stretch or irritate them. Even when surgeons preserve the nerves, recovery can take months to years, which is why many men still feel desire but struggle to get or keep an erection. Hormones add another layer. Testosterone drops by about 1% each year after 40. Low testosterone can affect energy, mood, and sexual desire. But most studies show that erections depend far more on blood vessels and erectile tissue than testosterone alone. That's why some men with normal testosterone still struggle, while others with low testosterone may still get firm erections if their vascular health is strong. Chronic health conditions make a big difference too. High blood sugar, high blood pressure, and high cholesterol all reduce blood flow or damage nerves. And many common medications, including some for the heart, blood pressure, anxiety, and depression, can affect sexual response. Cleveland Clinic lists more than 200 medications that may influence erections. Daily habits also matter. Sitting for long periods reduces blood flow to the pelvis. Chronic stress raises cortisol. Poor sleep lowers natural testosterone. Strong or rough stimulation during masturbation can reduce sensitivity over time. When these factors combine, erections naturally weaken. But the most important message from major medical sources is this: many of these changes can be improved. Some can be reversed, and even those that cannot return to age 20 levels can still improve enough to restore satisfying sexual function. So now let's move on to the part most people are waiting for, the solutions. Now let's talk about the first and most important solution: improving blood flow and endothelial health. A large number of studies from Harvard Health, Mayo Clinic, and the American Heart Association all point to the same insight. Most erectile difficulties after 60 begin with blood vessels. The penis is not a separate mechanical system, it's a vascular organ. When blood enters quickly and stays inside the erectile tissue, an erection happens naturally. When blood flow weakens, everything becomes less reliable. The encouraging part is that many aspects of vascular aging can be improved. Research shows that even modest changes can noticeably increase nitric oxide, improve circulation, and restore sensitivity that many men thought they had lost for good. One of the strongest tools is moderate physical activity. About 150 minutes of weekly movement, brisk walking, cycling, swimming, is enough to raise nitric oxide levels, support healthier arteries, lower blood sugar, and stabilize blood pressure. These effects directly help erections because they improve how blood reaches and fills the erectile chambers. Diet plays a similar role. Foods rich in natural nitrates like arugula, beets, and spinach help the body produce nitric oxide more efficiently. Many men notice that when they add these foods regularly, warmth and circulation in the pelvis begin to improve. Sleep is another overlooked factor. Poor sleep lowers natural testosterone and increases cortisol. Both make erections harder to achieve. Medical research suggests that 6 to 8 hours of quality sleep each night helps restore hormone balance and endothelial function. Weight management also matters. Losing just 7 to 10% of body weight for those who need it has been shown to significantly improve erectile response. This happens not because weight loss targets the penis directly, but because it reduces inflammation, improves insulin sensitivity, and helps blood vessels work more smoothly. Across multiple medical sources, the message is consistent. When the vascular system becomes healthier, erections not only improve, but the sensation and fullness of those erections often return as well. Now let's move to the second solution, restoring the health and elasticity of the erectile tissue itself. This part speaks to something many men notice but aren't sure how to explain. Erections don't just feel weaker, the penis sometimes feels smaller or less full. This isn't imagination. Mayo Clinic and several urological journals describe how the erectile tissue can gradually lose elasticity when it doesn't get enough oxygen over time. The erectile chambers behave like a soft, expandable sponge. When oxygen-rich blood enters, the sponge expands and stays firm. But when nighttime erections decline, which happens naturally with age, or when blood flow weakens, the tissue may not receive enough oxygen. Over months or years, some of those elastic fibers can be replaced by stiffer material. This makes it harder to stay firm and can reduce overall length. One of the most effective ways to restore oxygen to the tissue is by using a vacuum erection device in a controlled, gentle way. Despite the mechanical name, the concept is biologically sound. The device draws blood into the erectile chambers and helps deliver oxygen to areas that haven't been receiving enough circulation. Clinical reports show that consistent use over several weeks or months can help improve the tissue's ability to expand, improve how well blood is trapped, reduce the progression of scarring, and maintain natural length. This method isn't only for men with severe erectile dysfunction. It can be valuable for men with mild or moderate changes, or those recovering after prostate surgery. Many individuals begin noticing improvement within 4 to 8 weeks, with deeper benefits appearing over several months. Technique matters. Slow, steady use is key. Pumping too quickly or using too much pressure can feel uncomfortable, but when done correctly, it becomes a reliable way to keep the erectile tissue healthy, especially for men who no longer experience regular nighttime erections. Studies also highlight another benefit. Regular oxygenation of the tissue helps prevent further shortening and maintains natural girth. That's why many rehabilitation protocols after prostate treatment include this technique as a core component of recovery. Next, let's talk about another important solution, making erectile medications work more effectively. Drugs in the PDE5 inhibitor family, such as sildenafil and tadalafil, are among the most commonly used options. But many men in their 60s or 70s find that these medications don't work as well as before. Medical sources explain that this often has less to do with the medication itself and more to do with how the body processes it. Research from Mayo Clinic and Cleveland Clinic highlights several key points. First, timing matters. These medications need time to absorb and circulate. For some men, this takes 30 minutes. For others, it can take an hour or longer. Taking the medication moments before intimacy usually leads to disappointments. Second, meals matter. A heavy, fatty meal can significantly delay absorption. Some studies show that sildenafil taken after a large, greasy dinner can lose a good portion of its intended effect. Third, stimulation is essential. These medications don't produce an automatic erection. They enhance the natural response when there is arousal. Stress, tension, or lack of emotional connection can blunt the effect even when the medication is in the bloodstream. Some men benefit from the daily low-dose version of tadalafil instead of the as-needed version. Daily dosing creates a stable level of medication in the body, which can be useful for men with unpredictable timing or more advanced vascular changes. But the most important message is this: medication is not always the right tool for every situation. When blood flow is severely impaired, nerves are damaged, or the erectile tissue has become significantly less elastic, pills may not be enough. And that brings us to the next group of solutions: options that work even when medications no longer do. Now let's look at a solution that remains highly effective even when pills stop working: injections directly into the erectile tissue. Hearing the word injection can feel intimidating at first, but medical reports consistently show that this method has one of the highest success rates, often between 80 and 90%, especially in men who no longer respond to oral medications. And surprisingly, most people who try it say the discomfort is far less than they expected because the needle used is extremely small and the medication spreads quickly. What makes this method unique is its independence from weakened blood vessels. Pills rely on your body's ability to dilate blood vessels, something that becomes harder with age. Injections don't depend on that. They work directly inside the erectile tissue, helping the chambers expand and hold blood more effectively. This is why the method remains reliable even for men with long-term diabetes, advanced vascular disease, or those recovering from prostate treatment. Another advantage is that the response is predictable and fast. Many men notice an erection beginning within about 10 minutes. This sense of control can be reassuring, especially for those who have experienced inconsistent results for years. As with any method, proper dosing matters. Starting low and adjusting slowly helps prevent prolonged erections that can feel uncomfortable. But with the right approach, injection therapy becomes a dependable option for men seeking a clearer, more consistent solution without committing to surgery. Now let's turn to something equally important: restoring nerve function and pelvic coordination. For many men, especially those with long-term medical conditions or a history of prostate surgery, the nervous system plays a big role in erectile changes. Scientific literature often describes the erection pathway as a delicate signal chain that must travel smoothly from the brain through the pelvis and into the erectile tissue. When these nerves are irritated or weakened, the signal may arrive slower or not strongly enough. One of the most helpful tools described in urological rehabilitation is pelvic floor training. When these muscles are strong and coordinated, they help stabilize the pelvis, trap blood inside the erectile chambers, and support firmness. Many men are surprised when they discover that these muscles weaken with age or prolonged sitting, and equally surprised by how much improvement they feel once these muscles reactivate. Gentle stretching of the pelvic region can also make a difference. Tightness in the pelvic floor, often caused by stress or years of sitting, can interfere with nerve signals. Releasing that tension can lead to better sensitivity, improved reaction, and even a calmer mental state during intimacy. For men recovering from prostate surgery, nerve recovery can take anywhere from 6 months to 2 years. During this period, combining pelvic floor work with gentle blood flow support, such as a vacuum device, helps protect the erectile tissue until the nerves begin to function more fully again. The key idea is this: nerves do recover, and movement plays a major role. Supporting the nervous system while protecting the erectile tissue gives the best chance for improvement over time. Next, let's talk about something many men overlook: the effect of stress, tension, and expectations on erections. This isn't about saying everything is in your head. It's about recognizing how deeply the body responds to emotional pressure. When stress rises, cortisol and adrenaline rise with it. These chemicals tighten blood vessels and shift the body into a stay alert state, which is the opposite of the relaxed conditions needed for sexual function. Many men describe a pattern. After a few disappointing attempts, they begin to monitor their body during intimacy, wondering whether things will work or fail. This internal pressure makes the body even more tense, creating a cycle where worry itself becomes a physical barrier. Several practical approaches show promise in the research. Slow breathing reduces heart rate and helps the nervous system switch out of stress mode. Mindfulness techniques allow the body to relax instead of monitor itself. And for many men, emotional closeness, gentle intimacy, and environments without pressure help restore the natural mind-to-body connection needed for arousal. Expectations also play a surprisingly large role. When the mind focuses entirely on maintaining an erection and instead of the experience of intimacy, the body often struggles. Shifting the focus to comfort, connection, or sensory enjoyment can remove much of the tension that interrupts sexual response. When this psychological layer is combined with biological strategies like improving blood flow or strengthening pelvic muscles, men often see improvements they couldn't achieve with medication alone. Now let's examine a solution many people ask about: low-intensity shockwave therapy. Shockwave therapy has gained attention in recent years because it encourages the body to form new microvessels, potentially improving blood flow. Studies generally show the best results in men with mild to moderate erectile difficulties, especially when the main issue is reduced blood flow rather than severe tissue damage. However, results vary widely depending on the individual. Men with long-term diabetes, advanced vascular damage, or nerve-related causes often see less benefit, and men who have undergone prostate surgery may not respond well since the issue is usually neurological rather than vascular. Something important to understand is timing. Shockwave therapy does not create immediate changes. It usually requires a series of sessions, often 6 to 12, with improvements developing gradually. Some men notice results after several weeks, while others need more time. Even though shockwave isn't a universal solution, it can still play a valuable role when combined with other approaches. For example, improving overall circulation, maintaining healthy erectile tissue with gentle vacuum therapy, and using medication correctly can all enhance the benefits of shockwave for those who are suitable candidates. Now let's move on to a topic many men are curious about: testosterone and hormone therapy. Testosterone often gets labeled as the main driver of erections, but medical research paints a more accurate picture. Testosterone influences desire, energy, focus, motivation, and overall vitality. But erections themselves depend far more on healthy blood vessels and the condition of the erectile tissue. So when testosterone drops, which naturally happens about 1% each year after 40, a man might feel less motivated or less interested, but that doesn't automatically mean testosterone is the root cause of his erection issues. Research highlights 3 points worth remembering. First, true low testosterone must be confirmed by proper testing. Levels naturally fluctuate, so measurements need to be done in the morning and repeated at least twice. Second, treatment only helps the men who actually have low testosterone and symptoms. If testosterone is low but symptoms are minimal, the benefit is usually small. And if testosterone is normal, adding more typically does nothing for erections. Third, hormone therapy is not a performance booster. It's a medical tool meant to restore normal levels in men who truly lack the hormone. When hormone therapy is used appropriately, some men report improved energy, better mood, stronger desire, and improved well-being. And when those emotional and physical components feel better, erections may feel easier as a result. But testosterone alone cannot overcome weak blood flow or damaged erectile tissue. So hormone therapy is best thought of as supportive, one piece of a larger puzzle, not the core solution. Now let's talk about the option with the highest satisfaction rate, the penile implant. For men who have tried pills, vacuum devices, shockwave therapy, injections, lifestyle changes, and still cannot achieve a reliable erection, there is a solution with a long track record and a satisfaction rate of around 90 to 95%, the penile implant. This solution is especially valuable for men whose erections stopped working because of long-term diabetes, advanced vascular disease, prostate surgery, or severe nerve damage, conditions where blood flow or nerve function simply cannot recover enough. The most common type is the 3-piece inflatable implant. Everything is placed inside the body and completely hidden. When a man wants an erection, he activates a small pump discreetly placed inside the scrotum. When finished, he presses a release valve and the penis becomes soft again. Nothing is visible from the outside. It doesn't affect the bladder, the prostate, or the testicles. And after a short adjustment period, most men say the erections feel natural, firm, and predictable, with full control over timing and duration. What makes implants unique is that they bypass the body's weak points. They don't depend on blood vessel dilation, nitric oxide levels, nerve signals, or medication timing. They create a firm erection every single time, regardless of age or medical history. Men who choose this solution often describe something deeper than physical improvement. They describe getting their confidence back, rebuilding emotional closeness, or restoring a part of their identity they thought was gone forever. For that reason, implants are considered the final step. Not because they are extreme, but because they provide the most reliable outcome when everything else has failed. Now let's finish with a practical roadmap, a 6 to 12-month plan that many men find helpful. All of the solutions we've talked about become more effective when placed in a clear, structured timeline. Medical sources from Harvard, Mayo Clinic, and the American Urological Association often emphasize that consistent habits applied gradually can create meaningful improvement over months. Here is a simple framework. Months 1-2, restart circulation, light movement, better sleep, more nitrate-rich foods, hydration, and, if needed, a small amount of weight loss. Many men start feeling warmer circulation and improved energy. Months 3-4, reoxygenate the erectile tissue gentle vacuum therapy several times a week, plus correct timing of medications if used. The goal is to deliver oxygen back to the erectile chambers. Months 5-6, strengthen the response. If needed, consider shockwave therapy or injections. This phase focuses on building reliability. Months 6-12, stabilize and maintain. Keep blood flow habits in place, continue pelvic floor support, improve sleep, reduce stress, and maintain tissue health. This is when improvements become consistent. And when should someone consider an implant? When every earlier step has been tried seriously, and erections are still not reliable enough for intimacy. In those cases, the implant becomes not just an option, but the most effective path forward. This roadmap helps men see that change is possible. Not overnight, not magically, but through a structured process designed around how the body actually works. When you understand what's really happening inside the body, things become less confusing and far less frightening. Erectile changes after 60 are not a full stop. They're simply a sign that the body needs a different kind of support. And modern science offers multiple ways forward, even for men who feel they've run out of options. If you'd like to keep learning practical, science-based strategies to support men's health as you age, make sure to subscribe to Vitality Digest so you don't miss the next video.